Welcome to the Skilled Nursing Facility Consolidated Billing Question and Answer webinar. SNF Consolidated Billing is one of our top denials, so we're here to help you locate resources and answer some questions. The goal is to take those questions and provide you with a resource to answer it. I'm Tom Ryan with Provider Arts Education, and I'll be your presenter. Today, I'm joined by Ashley from my team, who will help with providing me those questions that you're asking in the chat. She may be able to offer you some additional information in the chat, so please remember to watch for that. Remember that we do have some disclaimers at the end of this presentation. They do incorporate things like CPT disclaimers and other things like that, so we always recommend that you take a look at those if you have questions. Our goal today, what's our objective? To answer your questions regarding skilled nursing facility consolidated billing, to get through as much information as we can within this hour. We will provide an overview. I'm going to look at the CMS files, and then we're going to provide the question and answers. The reason that we're doing it in this order is because you did ask for certain things, and so in order to meet those requests, I have to start back. Okay, I will point out what was asked for throughout this because this is a question and answer session. So let's do that overview first. The first thing I want you to be aware of is as you get through anything, you can see I did give you the information here. I want you to put your questions in the chat. That will help Ashley be able at the end to give them to me. But the first thing is during registration, you said I need to learn more about just general consolidated billing. I was asked straight out for an overview and information about consolidated billing. With that, I didn't know how experienced some of you were, so I thought, well, we better start with just a general overview before we get too far into it. So again, general overview, provide some basic information. The one thing to keep in mind is this is a very complex topic, and I'm going to provide just a little bit of information on it. So if you want the full piece of information, I do recommend that you go to our YouTube channel, look for the Consolidated Billing, Skilled Nursing Facility Consolidated Billing playlist. I asked Ashley to throw a link to that in the chat. That's going to get you all of the information plus the CMS website. So I'm going to give you all those different resources. One other area that I did want to point out for some general information is the Skilled Nursing Facility Consolidated Billing Specialty and Services page, which is right here. If you select this information within the PowerPoint, it will actually take you there. You can see, I don't know if you guys can see it, but mine says verifying that the information is correct, doing all that. This page provides you with basically everything we're going to give you plus our own resources. So it's CMS resources and WPS resources. For those of you who are like, oh, I've never seen this type of a page before, when you're on the WPS website, WPSGHA.com, start going to the training center. When you're in the training center, scroll to the bottom. Here we have the specialty services training and resources, and this is where all those different pages are. Again, look for alphabetical. Here's Skilled Nursing Facility Consolidated Billing, and you can go through, and that's exactly what we looked at. So I think that's a great starting point as we get through some of this information. Also, it's also a really nice starting point if you have someone new who's just like, and Skilled Nursing Facility Consolidated Billing seems to be a little bit over their head. All right, let's get started with a little bit of the overview. So Skilled Nursing Facility Consolidated Billing, or SNF CB, is a form of bundling. This is an inpatient bundling. Okay, so what that means is that the SNF is responsible for most care. The SNF receives one payment for all included services during a Part A inpatient stay. If this is a swing bed skilled nursing facility service. Now, a swing bed is simply a hospital bed that is being used as a skilled nursing bed. Swing bed could be used as a hospital bed, but today it's being used as a skilled nursing bed. Then yes, consolidated billing does apply. CMS does outline a variety of information on skilled nursing facility consolidated billing on their website. We'll take a look at this in a little bit, but this is just a quick link to get there. Okay. One thing to be aware of is that you'll hear the term stays for consolidated billing purposes, and they do matter. A Part A stay is when the skilled nursing facility is being paid for the room, the board, the nursing care. It's under the Part A benefit category, That is a Part A stay. During a skilled nursing facility stay, there are 100 Part A days. Again, room, board, nursing, care, all of that falls into that. Once they reach 101 days, then they move into the Part B stay. You can also start in a Part B stay if you don't meet a technical portion of the Part A stay. We'll talk more about that in just a moment. But a Part B stay means that the Medicare Part B benefits are the only payable benefits. That means Medicare is not going to pay the SNF or the skilled nursing facility for the inpatient care. Again, room, board, nursing care, all of that type of thing. Okay. So here's a couple of things to keep in mind. Part A stay lasts 100 days. Should all criteria be met, this includes the 3-day inpatient qualifying stay. An inpatient qualifying stay occurs from a hospital stay. Doesn't matter what kind of hospital, but a hospital stay. It is the day of admission, a full day, another full day, and then a day of discharge. So 3 midnight census, if you want to put it that way, however you'd like to put it, but it has to be 3 days. Along with that, they must be admitted to the SNF typically within 30 days, unless there's an established written plan to explain why 30 days is not going to be used. So maybe they need to get some additional care. Maybe they're going to go home, do whatever the situation is. So those are the types of things that must be met. If those are not met, then they will automatically enter into a Part B stay. So those are technically not part of the benefit package because they didn't meet 1 to 3 day qualifying stay or did not enter within 30 days of the 3-day stay. Okay. So someone did ask us, when we talk about these two types of stays, how do they restart the Part A stay? And the key difference is you need to stop being inpatient in all types of care. So it doesn't matter what type of facility it is. You cannot be inpatient for 60 or more consecutive calendar days. That will then restart a Part A stay. So that means that yes, a patient can have more than one Part A stay in a year. They could also have more than one Part B stay in a year. That also means that a patient could simply have one Part A stay in a lifetime. The question that came about with that, and the reason that I put that in is this provider gave me an example of someone that meets the Medicare criteria for tube feeder, medically necessary. That person will make 100 days, and once that 100 days passes, they will never come off of that because they're constantly getting that nutrition. They need that. So they will never move into a 60 non-consecutive or 60 consecutive days without medically necessary services. So there's 2 questions answered. We also use a couple of different terms for excluded services. Medicare excluded services is the main one that you hear a lot of, not related to skilled nursing facility consolidated billing. If it is a Medicare excluded service, this means that the law excludes it. It is not a Medicare benefit. It has nothing to do with consolidated billing. It's a Medicare excluded service. On the other hand, there is a SNF consolidated billing excluded services. This means it's not part of the bundle. It's not part of the bundle. It's not about the skilled nursing facility's payment. They may be paid for something separately, but the consolidated billing means you as an outside provider don't bill the SNF, and the SNF as looking for all of the services does not include this on their claim. Okay. So that means the provider performing the service would bill Medicare, the SNF bills for the inpatient care or whatever they're doing for that care. And there are some outpatient Part B services the SNF could definitely be reimbursed for. So when we talk about those, please don't get those too confused. If I'm trying to get you to understand that it's a Medicare excluded service, I will use the term Medicare excluded service. Otherwise, if I say excluded service during this course, it's a consolidated billing excluded service because that's really what we're focusing on. Reimbursements. Reimbursement for Part A and B services, they're all sent to something called the Common Working File. I put this slide in because there was a question about being reimbursed for an outpatient Part B service, and then a skilled nursing facility suddenly comes in and their money is taken back. This does happen. So this is part of the way that the reimbursement occurs in the billing cycles. But what I want you to remember is that Part A services will always override Part B services. Inpatient first, outpatient second, which is why skilled nursing facility consolidated billing, that form of bundling, even applies. This is part of the Social Security Act, and we'll give you a little bit more information on that. So what will happen is the common working file, if a Part B service is paid and then a Part A service comes in, will send an automatic request. That automatic request opens an overpayment and takes your money back. It's not something that I look at, it's something that any person looks at. The only way to get someone to actually look at that, and by someone I do mean a person within the WPS, is to file an overpayment appeal. So hopefully that all makes sense together. If not, put some more information in chat. I hopefully got through all the components of that question. So along with that, I guess this is the last part of that question. Can SNFs send their bills at any time? And I'm not really sure what you mean by that, but here's how I interpret it. So if I did interpret it wrong, please let me know. First, Part B services. You're a physician, you're a lab, you're something, and you're going to bill on a 1500, or you're going to bill on an outpatient type of claim for a UB04. Maybe you're going to bill those on electronic versions, whatever. Okay, so it's a Part B service. You can send those at any time. We had one provider tell me they were so efficient that their claims were being billed, if in the morning, their claims were being billed that afternoon, and if in the afternoon they were being billed the next morning. That's pretty amazing to me, but it is something that can be done. It's not a problem. Medicare doesn't say anything like that. Now here's what happens, especially with skilled nursing facilities. Their first claim comes in and it is a monthly charge, but it's also an admit charge. And it does contain more than just the first service. What it does is contains the first month or the entire stay. The entire stay would mean it's less than a month time frame. What happens is then each claim for the skilled nursing facility is billed monthly in chronological order as long as the previous month's claim has processed. Well, what does that mean if they're suddenly getting late charges, if they're suddenly getting all of these other things that definitely can happen as part of consolidated billing or that bundling portion? It can stop their claim from processing. It can cause other issues. It can cause takebacks that, we're trying to figure out how much they should have been billed, etc. It also means that when the skilled nursing facility sends in their initial bill, which again could be 45 days after the admit, etc., because remember it's a monthly charge, everything that processed for Part B services that should have been part of that inpatient skilled nursing facility stay will automatically send out a notice saying you owe us money. So hopefully I got all of that wrapped into that SNF billing scenario. It's a little bit of a long process there. All right, next I was asked for what kind of services do we carve out of the skilled nursing facility service? So in other words, I call them outside the scope of a skilled nursing facility. What services does CMS deemed outside the scope of a skilled nursing facility? So I want to review the documents to verify when it's the facility's responsibility versus Medicare's responsibility and the patient responsibility. Okay, so we're going to put all this together into one big categorical file. So the first thing I want to do is you guys are going to have slide 12, which is great. It's going to be CMS website. If you walk through slide 12, probably down through around slide 16, you're going to see that these files or these are all talked about. On the other hand, I'm going to go to the website and actually talk about them. So please be aware of that. All right, so to start with, skilled nursing facility consolidated billing is a national item. It's not something WPS made up. It is something that CMS requires. So we go to cms.gov, cms.gov. They put files together each year that dictate whether or not a a service is outside the scope of a skilled nursing facility and the criteria that are met, that need to be met to meet that. So we're just going to start off and we're going to say, okay, I'm on CMS.gov, go to Medicare. Inside Medicare, what do you think you would want to go with? I'm going to go with coding and billing, and I'm going to go with consolidated billing. Okay. So you can see coding and billing on the left, consolidated billing on the far right column, second item. Once we open that up, we're going to be in a area that just simply explains about it. You know, hey, which laws affected it, the Balanced Budget Act, all of these different things that you need to be aware of. So what's great about this page is when a skilled nursing facility refuses to pay you, or you think they should be paying you something, this is actually the law. Okay, so this is where it came from. This is where it starts from in the United States. So they do have to follow it. Okay, then it goes through and says, okay, well, there's a bunch of stuff you have to know, like, is it a Part A file? Is it a Part B file? Part A, Part B? But you can scroll down and read some different information. You can also look at the Medicare Learning Network publications. We've given those of you a couple of pages on that. There's also this great page called Consolidated Billing down here. It's in the related links. I like to come here if I'm just looking for the background information. Again, here's that Balanced Budget Act. It just kind of walks you through all the different pieces of information you need to know. Okay, so hopefully that kind of helps you understand, you know, exactly what goes on there. Let's go back though for 1 second, and I'm just going to use the back button to get there. What I'm going to do is focus on these Part A files first. So this would be slide 13 for you guys. On the left-hand navigation, you'll see a variety of files. First, it starts with the Part B files. Then if we scroll down, it goes to the Part A, the FI file explanation. And each year is then laid out back to 2016. I'm going to use the 2025 files. Those are the most recent ones. When we do this, stop for a second. This is updates to that file list. So you want to make sure that all of these are things you're aware of. Okay. Just FYI. This file list is updated annually, as it says. So again, we're coming up on what should be changing in 2026. You will see a new file list, but you want to look for items like this that may have been added, changed, deleted, etc. Here's one that will be added in 2016. Okay, I just wanted to point that out because we do have I'm sorry, 2016. This one was added. I wanted to point this out. Here we go. These are the ones I meant. 2025. So these may not be on that file list, but they were in effect. I want to point this out because someone did ask for what's new, what's current, and what's happening. This is the best way to keep track of it. Come out and actually look at the file list. The files themselves change annually, but this is what's new or what was missed within those. Okay. Let's take a look down here at the bottom. The one that I really want to focus on is this PDF document because it's a great document. I will show you the actual files in just a moment. Now the file is a PDF file. Inside that file though, there are major categories. And this is what the PDF explains. So major category 1, major category 2. So if I refer you to a major category, I'm referring you back to this PDF document and then come back and read a little bit about what that PDF means. That's all I'm asking for. Okay. One of the biggest things I want to point out, major category 1, these are services that are beyond the scope of a SNF. A couple of things to keep in mind. When you read this, you need to read this introductory paragraph right here. Start with the first sentence. They must be performed outpatient in a critical access hospital or a hospital. Okay, that's it. That's all you get. Why is that important? Because if they're inpatients in a critical access hospital or a hospital, it means that someone should have discharged them. Who should have discharged them? The skilled nursing facility. If they're done on an outpatient basis, it's somewhere other than one of these, an ambulatory surgery center, a freestanding diagnostic center, any of that, then it's included in the skilled nursing facility. Consolidated billing portion, how do I know that? Because it tells me that right here, and then it says I got to go down and figure out the categories. And I will tell you, please don't say, oh, these don't have procedure codes. That's what the big list is for, okay? Big list. We were asked quite a few questions about emergency services that are still, even though performed in an emergency room, are still being bundled into the skilled nursing facility payment. And I want to point this out. Right here, it tells you that if the hospital does not bill the claim with a 045X revenue code or a 45X, which represents the emergency room, and then again, the varying the last digit on the same line item data service, it does bundle. It does. I don't know what to say with that. Now, again, if there's certain things that happen, here you note in order to bypass services related to the ER encounter. So it's not going to be billed necessarily with this, but then we do have to have the ET. Any of this information can cause issues. So hopefully all of that does make sense to you for that emergency services, but I really do need you to read through this section right here. Okay. So what does it look like if we go back and we select this, which is our actual update file? It will look like this. Awesome, right? Opened it up, nothing really major. I'm going to select this bottom one. When I select the bottom one, this is where you see the major differences. Ashley, is that big enough where you can read that?
Let me make my screen a little bit bigger. It's a little bit blurry on my end. There we go. Yep, I can see it just fine.
Perfect, thank you. Okay, so this is the list. I call it the list because it does go on, but it does actually give you the procedure code. That means you have to be able to give me a procedure code to find out which category that falls into. Okay, and then you get to scroll through and find out different things. Once you find out the major category, go back to the other major category explanation, look it up. Okay, I'm just going to use one as an example. So what do we know about this CT scan? Well, it's a major category 1A. Awesome. It does not have dye. Here's the one with dye, so it's the same thing. But they're both going to be included in consolidated billing unless they're provided in a skilled nursing facility. I'm sorry, in a hospital or critical access hospital, okay? No, what this doesn't talk about is the professional and technical component, because there's a professional reading that goes with this. And so there's another file that goes with that. But how do you find that file? We're going to jump back to the website again. We're going to look at these Part B files. So we went through the Part A files. Now we're going to look at these Part B files. Why? Because a professional component is always a Part B service. Even if it's being billed by, it's still a Part B service. So let's talk about that. When we look at these files, again, make sure we read through all this information, all these additions and deletions, and then you come down to these 4 files on the bottom. Now, unlike the Part A files, which has major categories, CMS does break these into 4 distinct files. I said this one is a professional service of, but also contains the taking of, so this would be a Part A file too. Gonna look like this right here. So here again, if I put the same procedure code back onto this one, I find out, wait, yes, it's on here. So what does that mean? If I go back to the top part, it says Part A professionals, or Part A professional component services billed with modifier 26. Okay, did y'all catch where I said billed with modifier 26 or submitted with modifier 26? These are not subject to consolidated billing. These should be submitted to the administrative contractor. So this tells us that you have to have a modifier 26 on this procedure code and that you submit directly to Medicare. What does that mean for the remainder of it? What's the remainder? The modifier TC, or the technical portion? That's when we jump back to this file and we find out that that portion is included in consolidated billing. So we were asked a question, and the question was, we have a service that has a professional technical component. However, both Medicare and the skilled nursing facility are denying it. I do not have the claim in front of me. I don't know what you're billing. Here's my speculation though. You are not split billing it per the instructions in file 2, which tells you in order for Medicare to pay this, you need to bill us with a modifier 26. You're not billing the SNF with the modifier TC, which would then indicate that they are responsible only for the technical component. I know it gets a little confusing, but hopefully that all made sense to everyone. And I did get to the point where I got to answer your question for it. Okay. A couple other things you want to be aware of. File 1, these are physician services. These will always be billable to Medicare because they are literally professionals. So there are things on here that you just kind of have to look for and find out. So this says, hey, I've got an office visit, and I did pull this up very specifically because we have a little bit more going on with this, but let's just say a 99213. Would this be billable? Okay, so the answer is first, are they inpatient? And are we following the inpatient? If we are, then we would need to build a skilled nursing facility code with the appropriate place of service, we'll talk more about that, versus the office or outpatient service code. That's part of CMS's files. We'll talk more about it, but I did want to show you that if they're in a Part B, say yes, this would be an appropriate outpatient code, but you do need to follow the coding guidelines. And again, there's just a ton of different outpatient professional codes. The exception to outpatient professional codes does fall in file 4. So let's, oops, where'd that go? Sorry, the website did not come. There we go. We're going to, oops, try this again. We're going to go to file 4, these Part B stays only, because these are services which are outpatient rehabilitation that have to be billed to the skilled nursing facility as long as the patient is in a medically necessary stay, regardless of whether Part A is paying. Okay, and it's because that's what they're there for. So we're going to select this. It's going to pop up our file 4, and it's going to look like this, and it will explain again all of this right up here at the top. So hopefully that all makes sense to you guys. I went through that fairly quickly, but again, if you have questions, we'll get those answered. That does bring us, as we scroll through, we went through this one and this one. We went through this one and this one. And now we're to the pre-submitted questions. Okay, so we're going to be starting on the pre-submitted questions. These will start on slide 18 for y'all, but please remember to put questions into the chat if you have them. Okay, so first of all, these are questions and statements, I guess. So the struggle is real with confirming the procedure code from the vendor before the procedure takes place. This is very true, and we do understand that. Sometimes confirming the procedure code with a vendor is impossible. And people say, well, what do you mean? Well, what if something happens during the procedure which moves it up or down? So what if there's levels within the procedure? There's time factors within the procedure. They aren't really sure of exactly what that code will be. So we know that you can't just automatically bill Medicare. You may have to go back after the fact and ask the questions. So not really sure what you're looking for with this one. A couple of things that people have found helpful. Now this is just coming from different providers, different people that we've talked to. One, they have a monthly billing list that goes out from the skilled nursing facility to the common vendors or to the primary care providers. And they say, hey, have you seen this patient? Common vendors that they use for examples were labs, x-rays, etc. And they ask questions. This is not a violation of HIPAA. So, okay, we want to make sure we're well aware of that. But we do understand here at WPS that this is real. This can be very hard. It's very time consuming. Unfortunately, the law is what it is, and we can't give you any more advice on that. Next, the attending to see if there's anything new. Please remember that, and the reason that this one is really timely is what comes out in 2026, those files should be coming out shortly, and those are what are new. So it's which procedure codes actually are considered outside the scope of the SNF. I have not seen anything that indicates to us that they're changing any of the information such as the criteria, the major category 1, 2, 3, all those different criteria that go into it. They're also not changing anything related to what we understand is HMO plans, which means no, they don't have to follow this. They can set up their own rules. This is a traditional fee-for-service Medicare option, or I shouldn't say option, requirement. Again, the Social Security Act says that. How a Medicare Advantage plan follows that, we don't know. We don't have any part of that. We can't see their billing system. We have no clue. So, all right, so question 1. I put this one in very specifically is because They do say, what is the easiest way to determine if you need to pay chemo? Easiest way for this does mean that you have to get that code and then go back to the major category list. So what if your vendor says, I don't know that? Well, then you can't utilize the list until you do. Okay, you can't utilize the list until you do. So there's a little bit of services going on back and forth with that. And so you'll have to know what the service is that's provided and then determine based on that. Then as quickly as you can get billed to the SNF if that needs to go there, otherwise bill Medicare. And again, what you're looking for is major category 3A. That's the section that you want within there. Are there any differences on consolidated billing for swing beds? And swing beds are in a hospital and must comply with skilled nursing facility medical necessity. Let's start right there. Consolidated billing does apply. Hospitals are subject to the skilled nursing facility prospective payment systems, but critical access hospitals are not because of the way they're paid. So it really is about a payment. It's not necessarily about consolidated billing, if that makes sense. So yes, things still have to be paid and they still have to go into consolidated billing in the swing bed in a CA, but how the CA is paid, your payment methodology is different. For those that don't understand, a typical hospital is paid under a prospective payment system. I'll make it as easy as possible. They get a dollar amount per day. Done. That's what it is. It is what it is based on diagnosis code. Okay. Critical access hospital, they are not reimbursed that way. They're reimbursed on a percentage, 101% of their actual costs. Therefore, it's a very different payment methodology. So that's why it's different. So again, that's about as briefly as I can get without going too far into detail. If you need more, please let me know. Next question. When Medicare denies for a SNF overlap and the facility will not pay, do you want to know? The answer is WPS does not need this information. We have no need for it. This is a legal dispute between the SNF and the provider. So the provider who gave the service, who's billing them, and the SNF's not paying them, this is a debt collection that is owed to that provider. You should follow whatever the legal action is for a debt collection for you. If you have questions, please consult your legal area, whether that's a consultant, an attorney, whatever's on file. But please don't forget to provide them with some of those basic pieces of information. This is where I come back to this page. And I'm just gonna, quickly move around here. I go back to the consolidated billing page because that's what will also reference the Balanced Budget Act, which put this into play. Right? So if they have this information, they can then look up and read through the legalese that goes with it. You guys can read through it too. I will tell you, I have tried to read it, but I'm not a lawyer and I'm not a paralegal. It's not my area of expertise. But I do think it's important to make sure that your legal person representing you knows this. Okay. Again, I do like this a little bit more because it does provide you with that, but goes on to give you a couple of other areas from the Government Accountability, Office of Inspector General, some different reports and things that are available kind of to help you out with that. Okay. So just a lot of basic information, places to start. Here is, oh, I forgot this one too. Down here under effective dates, please make sure that you give them the Benefits Improvement and Protections Act of 2000. This actually updates when it applies. It used to say it applied all the time, which was both Part A and B stays, and then it said, no, just Part A stays. That's what this act did. So we already went through the information, but I just want to make sure you're aware of where it's at. All right. So again, WPS is not involved. We don't need that information. We can't help you in any way, shape, or form. We find that the SNF will pay physician's rate, not the hospital rate, what is your recommendation on how to handle this? Sometimes they still will not pay even after we explain to them. Can you point out the exact error within the CMS that states they should pay the hospital rate? So let me just explain this. Medicare is not involved, nor is the MAC in the reimbursement amounts. This is between the provider and the SNF. Technically, if you do not have a contract, you have the right to be reimbursed up to what you bill. If you accept at a different rate, that's your decision to make as the provider billing the service. When the SNF pays you at whichever rate they pay you at, that's not something that Medicare will be involved with. Okay? We're not going to get involved in that. So if they're not paying you at the rate that you think they should be, we do recommend that you get your administrators involved, go back and forth. Perhaps consider putting a legal contract or a written agreement in place. It doesn't have to be a legal contract, it could just be a written agreement, but that specifies you'll bill us within this time frame, we're going to pay you based on this, so that way there's no clarification needed. It's just going to come in, yes, you either met the contract, you met the agreement, or you didn't. But in terms of Medicare, again, this one comes right back to right, because we aren't involved in that. That is a legal matter between the two of you. All right, well, that's going to bring us to the section I like to call chat questions. But before I do that, I do again have to go through those additional pre-submitted questions that didn't quite make the slide deck. Okay. So first one, by the way, also this gives you time to add questions to the chat. Did you guys catch that hint? Add questions to the chat. Why do emergency claims deny for skilled nursing facility consolidated billing? Okay, I don't know what is going on directly with this claim. Here's what I can say again. Let's go back to the website, jump back. I'm going to tell you that you need to make sure, oops, there we go. Scroll down to the Part A files and just make sure that everything is being met within that emergency area, which is here, right? Because what a lot of people are missing is this. We only say that because we know that that modifier ET isn't as used as much as we think it should be. But again, we don't know for sure. We don't know what's documented. So I'm not sure if that's what's happening. Hopefully that does help you out. I will tell you, if you have an individual claim number, that is what you must take to customer service. Along with that, tell them, we've looked the major category explanation, we're looking at G, it says this is what we're looking for. So a lot of people also ask with that G category, oops, sorry, if we go back to the file, which I do have open here. So we're looking for one, all right, it's gonna take this, cheat. And they're like, but this doesn't appear, right, in the file the way that I think it should. Well, that's because we don't have to have a major category 1G because the full explanation is provided in that billing area. Does that make sense? The major explanation provides it versus some of the other ones that need procedure codes. This one is not saying, hey, based on a procedure code. Instead, using that general explanation, it literally tells us what needs to be there. Okay, so hopefully that does kind of help you guys a little bit there. So can a skilled nursing facility bill Medicare Part B? Yeah, I'm going to assume they're in a Part B stay at this point, and absolutely. When you say bill Part B, please understand it's still billed on the UB04 or the 837I. All you're simply doing is changing the type of bill so that we know it's an outpatient service versus an inpatient service. Great. Yes, you can bill for those rehab services. We do want to make sure you're aware of that. They are billable only by the skilled nursing facility. So hopefully all of that does make sense. The next one was a very interesting question to me because it was anything regarding ambulance claims. I will tell you, I'm going to give you a brief overview, but we do teach a full 1-hour class on this because an ambulance claim is unique in that it is in both the Part A files and the Part B files, and people get confused because they're like, well, my procedure code is here. My procedure code is here. So let's start with ambulance trips. The first thing we know is that ambulance is major category 1A, okay? H, and it says trips associated with the following major categories, 1A through E and G, are excluded from consolidated billing. In addition, anything in major category 2A. So when we have to look through it, we really have to look through all of these different things. So I want to remind you The one that is excluded, major category 1A and G, is F. And why is this one? Well, because the surgery can be done in the skilled nursing facility. So we want to make sure you're aware of that. On the other hand, anything else while the patient is in a Part A stay that would be within these major categories, the ambulance stay would also be excluded based on that. But let's take a major category 1 service. Let's just take an MRI. So in general, MRI. The MRI is not being done at a hospital or critical access hospital. Instead, you're going to a freestanding diagnostic facility or a mobile MRI unit. Either of these are possible. Once that happens, then the MRI becomes part of the skilled nursing facility bill, which means consolidated billing does apply, and so does the ambulance trip. How it works, though, is that the skilled nursing facility cannot bill the revenue code for ambulance. That's 540. Don't do it. Not going to happen. How did you get them to the MRI? Through ambulance. So that is technically part of the MRI total bill. Okay, so the ambulance transport must first determine what the service is at the end destination, then go a step further and determine if it meets the criteria to be excluded. If it does, they bill Medicare. If the ambulance trip does not meet the criteria to be excluded, they bill the skilled nursing facility. But we also now have to enter into that not covered services category, which is a never covered service. And that's, does Medicare even consider coverage for this? If it's not medically necessary, then you will bill the patient. Again, with one exception, and that is to a physician's office. If you're billing Medicare, you can't bill to a physician's office. For consolidated billing, anything done in a physician's office will be billed back directly to the SNF. That's part of the regulations. And the reason that that happens is, could the patient have been seen at the SNF for that same service, even though they were taken to the physician's office? A lot of different stuff goes into that. It's a separate category, but I wanted to bring that up. So when we look at the ambulance transport, please determine first and foremost, is it medically necessary? The reason that that one came up is the question related to a late night transport where in their minds, no other method of transportation was available. Now, why do we say that? Because that's Medicare's standpoint is, if it could go by a different means, they should go by a different means, regardless of availability. So they didn't want to bother a child. They didn't want to call someone at midnight to be taken in. There is no ambulance wheelchair. I'm sorry, there is no wheelchair van at the hospital. Or I'm sorry, at the skilled nursing facility to transport to the hospital. Those do not make an ambulance run medically necessary. Okay. The EMT assessment, as diagnosing what skills, medical skills are needed for that EMT during that time of transport, do make it medically necessary. Also, you keep hearing me say the term transport. If you don't transport them, Medicare will not pay for that ambulance service. So hopefully all of that kind of wraps ambulance into a very quick little bit there. But again, if you want more, I do definitely recommend taking a look at that full class on it. It's not quite that easy, but it's as much information as I can get during this class. If a skilled nursing facility calls the emergency medical service or an ambulance service during a non-emergency transport to the ER, is the SNF responsible? Again, can you tell me if it was medically necessary? Just because they called for a transport to the ER and it went non-emergent, that doesn't necessarily mean it's not medically necessary. And that's our key difference there. When the EMT arrived, and again, an emergency medical technician can be basic, intermediate, or paramedic, and they did the assessment, what did they find with that patient? That's what's going to drive whether or not, okay? Now, can Medicare be paid? Again, you did very specifically say emergency transport to the ER. Let's go back over here. And is the ER service billed correctly? If it is, then it would be Medicare's responsibility. If the ER service is not billed correctly, that's when we wind up with some of those edits that hit place and take money back or do all those different things. So again, that one's very clear as mud because there's so many different components that go into it, and you have to make sure you meet each one of those components. So again, take a listen to that class. And this one, I'm not really sure what's going on here, but it says UHMC is denying claims for place of service as the patient's enrolled in a SNF but was seen by our provider's office. Provider's not contracted with the SNF, so we use place of service 11. After the claim denied, we tried talking to UHC Medicare and was advised to bill with place of service 32, but again, the claim denied. Should I bill the SNF or should I bill correctly with place of service 11? So first of all, I'm going to assume UHC Medicare is Part C plan, in which case we cannot give you any advice at all. I will tell you that for traditional fee-for-service Medicare, when the patient is enrolled in a skilled nursing facility and it is an inpatient stay and they are going to a physician's office, it is billed back to the skilled nursing facility. It is billed back with a place of service 31. Why? Because the Medicare Claims Processing Manual, Chapter 26, specifies this under the special circumstances area. I'm going to put that link for you in the chat at this time. Okay? Hopefully that gets some more information for you. I wasn't really sure where this person was going, so I'll say that up front. What type of procedures could be billed while in a swing bed? Pretty much anything can be billed. It just depends on whether or not it's part of consolidated billing, whether that moves them from the swing bed into the hospital bed. I don't really know where to go with that, but please remember that medical necessity must first be met. So if it's not a medically necessary service, then that would not be something you want to bill to Medicare. An example would be a personal comfort item, such as a fan. Those are not something that Medicare will cover. So again, not really sure where exactly to take that one other than there. All right. Next question. If the patient's in a skilled nursing facility, Part A stay, and while in the skilled stay in the nursing home facility and requires an office visit to our clinic, what is the correct place of service? Wow. So they're in a Part A skilled nursing facility stay and they need to come to your clinic. What's the correct place of service? If you are billing Medicare for anything related to that, the correct place of service is 31 or 32, depending on if it's a Part A or a Part B stay. If it is a Part B stay, or I'm sorry, it's 31. If it is if they're in a medically necessary Part A stay, it's 31, place of service, period. Make sure you bill the nursing codes. Don't bill an office code and stick a 31 on it. It's not going to work for an evaluation and management code. On the other hand, if they're in a Part B stay, then you could bill 32, depending on where you see them, with a nursing code, or you could bill an office code with place of service 31. Ashley's got a little bit more knowledge and works a little bit more commonly with, that's interesting, a little bit more knowledge and a little bit more commonly with evaluation and management. So I do want to throw that out there. Ashley, anything to add to that answer?
No, Tom, I would agree with that.
All right, thank you. And then that brings me to my last pre-submitted question. So what questions do we have in the chat?
We had a couple questions come in. The first one I think you already touched on, but I'll read this just in case. This is, do Medicare Advantage plans or HMOs follow these SNF billing rules, or is it only for traditional Medicare plans?
Only for traditional Medicare, as far as we know. You must ask each plan under the Part C category to find out how they do their information. So we don't really have a good answer for that because we don't deal with those plans. Is there another question?
We had one more question, which was, so to be clear, if the SNF receives a bill from a provider and the resident was skilled at the date of service stated, the SNF can send to Medicare a Part B claim for those services outside the SNF.
Okay, so is Medicare Part A covering that? So there's the question that I need to know. If they are, then they're sending their typical Part A stay. Okay, so the SNF, and so the resident then remains in a skilled nursing bed. This is what we call a Part B stay. Yes, the skilled nursing facility can send a claim under the Part B category benefit. Okay, outpatient, make sure it's marked outpatient, and those claims can be billed or paid underneath that. They'll be considered. Now, again, we always say considered because, we're going to look at medical necessity, we're going to look at policy, we're going to look at all those different things that factor into it. But yes, a SNF does have the right to bill for anything that a Part B would cover. And it would be billed on an outpatient or different than a not medically necessary. You've already given us the discharge. You already said, hey, there's no more days. So you want to make sure you get that billed correctly. I would recommend that you take a look at, again, it's a little bit of a different playlist. There's a consolidated billing playlist, but we also have a SNF playlist. And that one goes more into the actual billing portion. Let me show that to you right quick here. So when I keep talking about playlists, of course, we're talking about YouTube, and hopefully y'all can see these from your office. If not, I apologize, but you want to go to our channel, and you can see it's at WPS PO. If you type WPS GHA, something like that, it'll bring it up. You're looking for our little snowflake. Inside there, you can look through all of our different playlists. Lots of them. I don't really do that a lot myself, but let's type, nope. It helps if I spell it correctly. So if I'm looking for the consolidated billing, it'll give me some different aspects of it. Along with that, if I scroll down, it will bring up the skilled nursing facility playlist right here. And this is the one that we want, and here's the consolidated billing playlist. So this skilled nursing facility one, if I open it up, let me pause this, and you scroll through all these different ones, there are actual billing courses for skilled nursing facility and swing beds. They'll tell you how to bill, coverage and billing basics. I was just looking to see all the different ones that are out here because there's a lot of them, obviously. And then you can look through and find out the one that you're looking for. So hopefully that'll help you get you a little bit more feedback or more of what you need. Any other questions?
We do not have any more questions in the chat.
Okay, so we can go back to the PowerPoint. We'll keep going here. So again, thanks everybody for the questions. Want to remind everybody that we will give you the opportunity to take a survey. The survey will come out shortly. It's going to be put in the chat. It's already been in there, but I'm going to ask Ashley to throw it in one more time for you. It's just a link. We are going to give you the opportunity to go to that survey. You will see the external site pop up with a little orange indicator. When I close the webinar, it's taken to the same place and the same survey that Ashley's given you a couple of times here. Our goal is to get any feedback that we can related to consolidated billing or not related to consolidated billing. It just depends on what you want to give us there. But it does allow you to answer some questions related to this event, to myself, to all the different resources that I showed you, the way that I put the material together to see if it was helpful, all those different types of things. Okay. Couple of fast reminders and then I will let you go. Okay. So first, thanks for attending. I do want to remind everybody that you have 7 days to send in your information for questions related to this topic. So not just any skilled nursing facility billing question, it has to be a consolidated billing question. Again, 7 days. Put SNF CB in the subject line. That helps the person that gets it make sure it comes to me. It's really important. We want to make sure that we get those in the next 7 days. You will receive an email with a thank you. The email is an automated email sent from our system. So that email does contain a certificate of achievement with contact hours. Contact hours are used for CEUs, continuing education units. We do not give you CEUs. If you called in only and you did not enter your email address when you signed in and you just use a call-in number, then we cannot send you that email. So you want to make sure you're going to send us to the follow-up email and you're going to put in the subject line SNF CB. In the body, you're going to say, please send me a certificate so that I can send you a copy of that email. What I need from you also is a phone number, and that phone number must contain 10 digits. That is what we have to use to verify. If we do not verify when we give you contact hours, then governing bodies don't like that, and they can take away your ability to get CEUs for our education based on contact hours. We don't want that to happen. So that's what you have to do. Remember, you have 7 days to do any of that information. Again, if you do have a follow-up question, we will put together a quick email back to you or to everyone, depending on the question. If it is something specific to a claim, if you have a claim number, contact customer service, give them the claim number. They can help you through that process. We're unable to do that. We do continue to do more consolidated billing courses. So if you're new to this or you want more information, I do recommend that you continue to watch our live events. Just register for those as they come up. Check one more time. Ashley, any questions?
We do not have any questions in the chat.
Okay, so on behalf of myself, Ashley, all of Provider Outreach Education, thanks for your participation. We really look forward to seeing your comments on those surveys, and we hope that you join us again in the future. You may now disconnect.